So there we go. Now we're ready to go. So like I said, I'm going to kind of just dive right into the presentation. If you have comments, questions, raise your hand, throw something in the chat, and I will be happy to go there. This is most beneficial when we all kind of collaborate together and share ideas and strategies and challenges and all that sort of thing. So let me share my screen. Okay, so like I was sharing at the beginning of this, I did this project when under the worldorganizing.org. I don't know what I just did. I started to share under that umbrella. And so the goal was to look at, after I did the exit interview project, one of the things that kept coming up in that project was, how do we build power in rural counties? And so we started to think, okay, so how do we do that? What's the most productive way for us to build power? And it's more than just about flipping counties and things like that, but it caused us to go in and really take a look at the data. So 3 things that I want you to remember is that the focus on the ones that made the final list, which in Nevada's case, all of them made the list and all the lists. So there's only 3, but we'll talk about them in just a second. But it doesn't mean that it's the only portion that's worth organizing. It's a short-term piece of a long-term strategy that we're going to go into. So 17 states made this list, Nevada being one of them. And so we're doing these deep dives for some of the, really swing states or key battleground areas, doing these deep dives to have really good conversation about how can we use this to be really effective. So I took time and went through literally all of the races from 2020 and 2022. So presidential races, House races, Senate races, gubernatorial races, then looked at voter registration data, voter turnout, state populations, percent rules to really kind of, get a good foundation to see, okay, so what's happened here and what do we need to do moving forward? So here's the way I did that. First, I started by kind of looking at, it's completely data driven. And so what I did was I started by looking at the states that had margins of 10% or less that were battleground states or key swing states or states with lots of electoral numbers, right? Electorates. And then once we identified those states, we began to look at the rural counties that had margins of 10% or less, or counties with a significant percentage of rural population, where those margins were 10% or less in each of those elections. And so then, you get this list of like these counties in this election, these counties in that election. And then I cross-referenced those and then began to find the counties that repeatedly showed up. Maybe not in every election, but the majority of them. And then once I identified those repetitive counties or those top counties that kept showing up, then it was time to look at, well, what's the population of that area? What's the percent rural of that area? And then where can we have a powerful move? So in some cases, that was in the presidential election. In some cases, it was in the presidential election and the House, and, in a specific seat that could be flipped. And the example that I give most often in this is because, like, when I was doing Colorado, and I'm just in the numbers, not really thinking about anything, I had 10 counties that showed up in Colorado. Well, when I got to this last step and I looked at the House race, 7 of those 10 counties were all in Bo Bart's district. And what I love about that is I didn't go looking for her district. The data led us to her district, which was great. And so that's what we did in a lot of these, in all of the states and in these races. We looked to see where we would have the biggest impact or the most power in doing that. Now, you might ask me, why did I talk about population? Well, again, we're talking about power. So there are populations and there are counties that are close in these races that didn't make the list simply because maybe they had less than 5,000 people there and it didn't make sense to put all our resources there. So when we talk about the engagement for Nevada, right, we know that the Democratic candidate won the 2020 presidential election by less than 3%. And then the 2022 Senate election was less than 1%. Douglas, Lyon, and Nye had 25,603 and then 41,196 registered voters who didn't cast a ballot. And I'm going to get into those numbers in a second. But what you will see is how we use this data and what it could do to increasing the leads that we have, and building upon what we've already established. It's not just about sometimes flipping seats. It's about maintaining wins. It's about strengthening positions, and continuing to build that momentum as we head into 2024. So this is the clean data. And this is the pretty version that you're going to get. I'm going to share with you my version that looks a little different from this, but this is what you're going to see. You're going to see the presidential data. You're going to see the House data, so forth and so on. And you'll see exactly what I'm talking about, where we looked at the number of votes, Dems, Republicans, the others, and then what district they're in for all of these races. Now I'm going to stop sharing really quickly, and I'm going to show you what my spreadsheet looks like, because it looks a little bit different. And you'll get to see kind of the work behind the scenes. This is beneficial just so that you can kind of see how this process came about and then ask questions. So as you can see, mine looks a little bit different than the clean and pretty version that you're going to get. Some things that I want to point out in this data. You get the clean version of it, but I want to just kind of show you what I was looking at. So for example, this is your voting data, your registration data that I'm highlighting right here in the middle. And this is the registration as of about 3 or 4 months ago when I did this data. So in Douglas County, the population is 49,628. There were 40,662 people registered to vote. That's almost 82% of the population, right? And then you look at Lyon, which is 70%, and then Nye, which is 62%. Well, then look at the actual voter turnout. And you'll see that even though 82% of the folks in Douglas are registered to vote, about 64% are actually turning out to vote. And whereas only 70% of Lyon is registered, 69% is turning out to vote. So what does that help you know? It helps you know it is not voter turnout that's an issue in that county, right? It is about increasing the number of people that are registered to vote. So that's one of the things that you want to take a look at in this data, is to see who's turning out, what percentage of the population is turning out versus who's registered to vote. That helps you know what type of campaign you need to be doing. Where do you need to put your resources at? Is it a strong GOTV, or is it a voter registration drive? Things like that. The thing that is really significant that I want you to see is those two counties that had 69% voter turnout in the presidential election, that was cut in half almost for the gubernatorial and the Senate. And while we expect a drop, we don't expect to see like a 50% drop, right? Something happened between 2020 and 2022 in these races, because now you only have about 36% of the population turning out to vote versus 70%. It's almost 50%. Now, if you're in Nevada and you have some comments on this or some ideas to this, then I strongly encourage you, shoot me an email and let me know. But it's something that these would be conversations that I would be looking to have with people to find out what happened. Did you get, politic fatigue? Has all the rhetoric, that's been consistently bombarding us for almost a decade now, did it finally wear you down? Did you have candidates that you just simply didn't like? Did you know that, it was going to go the way that you wanted? I don't know. But this would be something that I would be very curious to see kind of what happened in those races. So that's, again, what we're talking about when we're looking at what sticks out in this data and what's important for you to see. So I'm going to drop on down a little bit and look at some of these other numbers that are in here. So in the presidential election, you'll see that 39% of the folks are registered to vote, 34,000 turned out. But did I say percent? 39,000, almost 39.5 registered to vote, 34,000 turning out. And you'll see that the Republicans had a significant win, right? They almost doubled the number of Dem votes in Douglas County. And you might be saying, oh, well, holy geez, why are we focusing on them? It's because of the percentage of people that are rural, that are available, and the votes that can be had there. So I want you to see the same thing that is possible in your Lyon that's affecting two different districts, right? District 2 and District 4. and it's about strengthening the leads that we already have. I would love it if you guys have some things to chime in as we kind of go along this route. The other part of that you can help flip these numbers is down here. Not every state does this, but I love it when they do. When it actually gives me the total number of people that are registered to vote and the breakdown. How many of them are Dems, how many of them are Republicans, and how many of them are other. So this is the column that I really want you to focus on for Nevada, because you have more people that are unaffiliated than there are that are registered as Dems. So what does that tell us? That's a great opportunity for us to shift those people over in the election. I can tell you, like, I'm going to do Alaska here in a little bit. Alaska became very difficult when they introduced that independent portion of the ticket. It cut the Dem votes by almost a half, a lot of times by at least a third, and it's significant. So this is a group of voters that is available to us. That, what do we know about them? We know they're registered to vote, so they care. We know that they are casting votes. How do we know that? Because of the number of votes that are actually being cast, right, in the presidential elections and so forth and so on. We can actually even kind of see about how many. So this is 2023 numbers, but if I'm looking here and I'm saying there were 22,000, so I want you to also look, the population and registered number of voters has the registered number of voters has increased, but the population has also decreased, which we see a lot of. So this is an area where you can say, okay, where do we go and how do we reach people that are already registered to vote, already turning out to vote, or maybe they're registered and they're not turning out. But these folks are engaged to some degree because they are registered and they want to participate in the process. The other piece, and I know I'm talking fast, but it's because you guys aren't chiming in. It's okay. But the other piece is trends. So I became incredibly interested in voting trends when I was working the Stacey Abrams campaign last cycle. And the reason why is, in 2018, we had lots of people that were purged from the rolls. We've seen some of that happening in different states across the country. And so what I wanted to do is take a look at 2022 voter registration data versus 2020 versus 2022, and see if we have a gain of voters or a loss. So in Nye, we had a loss, but not by much, less than 1%. And everywhere else, we had a gain of registered voters. So that should tell you, for example, in Lyon, that people are interested in voting. It's become more important to them, whereas in some places, it's been the opposite. So you could walk away from the Nevada data knowing a couple things. So if I pop back over here to the final pretty version stuff, and I get to Nevada, which I'm having to scroll to because I was looking at Maine after this. So right here, if I'm looking at Nevada, I know that the presidential election was less than 3%. It was 2.39% difference, right? There were 33,596 votes. That was the difference. What do we know about the Republican Party? We know that they are heavily going after rural places, and they are going after rural places during this off cycle, right? So between these three counties, the number of registered voters that did not vote in that election was 25,603. So did y'all catch that? 33,596 was the difference in that presidential election. And 25,603 people were registered but didn't vote. That's 74.5% of that voting difference. So we're either going to go after those registered voters in these three counties that did not vote and increase that margin, or the Republican Party is going to come hard after our rural communities, and they're going to get those folks to vote. So again, this is why these three are so important, right? They're big counties. They're number 3, number 6, and number 7 in terms of state population rank, but they're between 32 and 37% rural. So there's 57,000 people, almost 58,000 rural people available to us in that area that we can bring to the table and get to vote and win them over. We just have to be able to do that with conversations that aren't triggering and divisive, even though the topics may be. So we're going to talk about that too in just a second. But the same thing I want you to look at is here for the Senate results and the gubernatorial races. There were 41,196 people that did not vote in the Senate race. And 7,928,000 was only the vote difference, right? That was less than 1%. That race was less than 1%. This is a race that is going to be super important the next go around for the Senate. And so this is a place where we have an opportunity to extend that lead and hold on to a seat that we won, if that makes sense. So I'm going to go back to the presentation really quickly, just to show you the rest of the data. Yes, Andrea.
Hi, sorry, I just wanted to ask a quick clarificatory question. I tend to conflate get out the vote with registering voters as well as getting voters who are already registered to the polls. It sounds like you're making a distinction between those two. Could you talk about that a little bit?
I am 100% making a distinction between the two. And the reason why we think about get out the vote as getting people, I think of getting out the vote as that crucial time where we need people to get out and get them voting. It is much easier to do get out the vote when you have already done voter registration drives, right? So when you are in areas where you notice that you have lower voter registration and lower voter participation, right? Then you can make a distinction between those things. I can tell you that in Georgia, and people would say, girl, I'm already registered. I'm already registered, right? But what I will also say to you, so for example, speaking about Georgia specifically, so I was in Georgia in 2017 and 2018 before I came back here to lead a healthcare protest for a few years. And when I went back in 2021, I went to the DMV, right? Got my license and I checked the little box that said, yes, update my voter registration information. Okay. Here's what I did not know. And I would not have known if I wasn't working the campaign. For 11 months of the year in 2021, the software that connects the DMV to voter registration was down. Now, why was that significant in Georgia? Well, because Georgia had changed its laws. During early voting, you can vote anywhere in your county, right? But on election day, you had to vote exactly at your precinct. Well, even though I had moved back and I was living within two blocks of where I lived previously, my voting location was different. So that would have changed and affected how I voted if I waited until the last day to vote. So when we start to have these conversations about voter registration versus getting out the vote, if I look at somewhere where 80% of the people are registered to vote, like Douglas, that is not my conversation. My conversation is verifying, making sure that you've checked it and it's up to date, and then getting out the vote, right? And if I notice that a lot of people are registered, but there's low voter turnout, it may be because you're automatically registered in that state and you're not interested in voting. So that's why I make that distinction, because in some states, as soon as you get a driver's license, you're automatically enrolled. But that doesn't mean I'm going to vote, right? So when I can talk to people about that, well, look, hey, it looks like you're registered to vote. Be like, no, I'm not. Well, maybe you were registered to vote when you got your driver's license. Do you not vote? Right? Share with me why. And that's one of the things. So when you talked about messaging, I tend to stay away from the word tell because it is so rare. I'm telling you, let me tell you. No, let me share with you. Share indicates we are in this thing together, right? So that's like another tool to use when you're like, let me share this data with you. Can you share with me? That indicates I really want to know. Don't just tell me, share with me. I'm going to share with you, right? It's just small little tweaks like that. But to answer your question, 100% making a distinction. Yeah. It also helps when you're going to have a conversation with people about funding. So, when you're looking at someone that you want them to give you your dollars, it's great data to be able to say, I'm focusing specifically on getting these people that are already registered out to vote. So they know what you're using their money for, right? So going back to this last little piece right here, maybe. If it lets me, it will. I know it will. It's just going to make me go back and do it. Cool. Got it. All right. So again, this is just the hard data. But when we get down here to the end, this is the part that I really want you to be able to use that strengthens what your cases are. It's this population data, the percent rule, right? Your voting data, so that you can actually see who's registered, who's not. Am I losing? Am I gaining? And then that voter turnout that I showed you on the other end, because that's going to tell you where you need to make your focus be and use the data appropriately. Now, what's going to happen after this? Okay. This is me talking about exactly what I already said to you. But I want to tell you what's going to happen after this. So in the next 3 to 5 days, you're going to get another email from me. That email is going to have this recording. It's going to have the PDF presentation. It will have a link to the Top 100 Rural Counties project. It will have a link to the exit interview project. Why do you want to have that? Because it has a lot of tips and tools about what organizers are doing that is effective, that is working, with some specific examples. And then it's going to have recommendations for not just organizers, but for philanthropic organizations as well as political organizations, because those things all need to work together and they each have their role to play. And then, of course, we do a monthly networking call that yours truly hosts, and we do that on the last Thursday of every month at 2 o'clock. That is a great space that is growing right now with rural organizers and candidates and, people that are doing the work that come together to collaborate, to share, to ask questions and, sometimes vent. But also to feel validated and have a sense of community, because we all need that. And we are going to need that, especially over the next 15 months or so. And then the next project that is coupled with this is counties without Democratic Party representation. So we're starting to identify counties that maybe they're close to being flipped, and they made this top 100 list, but they actually don't have party leadership and party representation there. And that's a place where we can say, okay, so who can step in and fill that gap? So that's the majority of the data, and how it works together, and that sort of thing. So if you have questions, I'm open to answer them, and kind of give you a little bit of feedback. If you have feedback for me, I would love that. And if you are interested in talking about more ways and examples of how to use the data in conversations and organizing, we can do that as well. So I'm going to kind of let John Ray and Elwood jump in here. If you have anything, if you don't have anything, you can put that in the chat as well. And I won't be taking up an hour of your day. I'll just be using 30 minutes. It's kind of up to you guys.
Thanks for that presentation. I'm afraid I don't have anything. I was just happy to listen to it. I look forward to playing around with the data. So thank you for that.
Yeah, you're very welcome. I will tell you, the more attended the presentations are, so like with North Carolina and Michigan, there were 38 people that registered and about 20 or so that actually showed up. I think Georgia had about 20 as well. And that was it became this really good conversation where, people from different counties were asking questions, and we were able to kind of dig in a little bit. We don't have as many it's funny because Nevada and Alaska, we don't have as many people that are registering. We're still going to send it out to all the people who registered, even if they didn't show up. But I really think the other piece that I'm adding, Johnny, I don't know if you said, yeah, you're from Texas. So, I did Texas as well already. I don't know if you know that or not. But I did Texas, and now the next piece that I'm doing, I don't know if you saw this or not. Let me see if I can share real quick. I'm not ready to share it with people, but I'll show you. So I believe that everything comes down to 4 pillars: healthcare, education, housing, and economic stability. So what I started to do, healthcare is kind of my jam. And so what I've started to do is to go through the counties that have made the list that also have hospitals that are at risk for closure. And so like Georgia is a great example. I had 9 counties in Georgia that, need to be focused on. 5 of those 9 have hospitals at risk of closing. That's a great piece of data, information that we can use in messaging, that we can use in policy, that we can use in organizing and all of those types of things. So that'll be the next piece that kind of builds onto this. So the goal is to take this baseline data and then be able to stack onto it so that it all kind of comes together, if that makes sense. So-
Yeah, that makes sense. I love that data that you talked about with the hospitals closing. We have I think we're going to try similar messaging stuff in Texas around the closing of rural hospitals for pretty much the same reasons you outlined.
Yeah.
And then also, I think what you said is really important about like something that people underestimate or don't appreciate about rural voters is how much they are feeling kind of a cost of living crisis, like you sort of suggested just now. Like if you like people think, yeah, houses are expensive in the cities, but if you ask rural voters, their biggest concerns: cost of housing, cost of taking care of their parents, cost of sending their kids to school, cost of healthcare. They're feeling that same kind of crunch that people elsewhere are feeling. And so I think what you suggested kind of on what you're thinking about for messaging going forward is really important. That's what I sort of second what you said.
Yeah, Texas and Tennessee are, so Texas is number 1 in rural hospital closures in terms of the number of them. Tennessee is number 2 in terms of the number of them, and Tennessee is number 1 per capita. And so one of the things that has come into rural spaces that they are looking to increase is something called a COPA. It's a certificate of public advantage. And like what they did here is they created a legal medical monopoly when our state legislature passed laws. It was a state senator who led this campaign and changed our laws for a healthcare company that he'd been employed by for a decade, right? And when I say a medical monopoly, I mean that they control 97% of all inpatient care here, and they own all of the hospitals. And so patients here, it has, put it this way, people are today starting to see why I led a protest and we all camped outside of a hospital for 257 days straight in 2019. And unfortunately, everything that we were afraid of happening has come to fruition. Our quality of care has declined. Our costs have increased. We've had some of our outerlying hospitals kind of, they say they kept them open, but they didn't. They closed them and repurposed them, right? So the building might be open, but it's not an inpatient facility anymore. We've lost ICUs, NICUs, level 1 trauma centers, all of those types of things. And so, rural places are some of the most at-risk places, and it tends to be our Republican states that haven't expanded Medicaid, and that are bragging about being fiscally responsible, who are allowing our hospitals to close. And so I'll give you this piece. What I've been saying to people is really simple. Is it fiscally responsible to hoard money, millions and billions of dollars in these rainy day funds, and yet allow some of our most vulnerable constituents and people to lose access to healthcare? The answer is unequivocally no. And the way that I communicate that to people here is I don't talk Republican and Democrat. What I simply say is, let me ask you guys a question. If DCS were to come to your house and you had 20 grand sitting in the bank, right? But your children had not been to the doctor, weren't up to date on their immunizations, and they didn't have food to eat, would you be fiscally responsible or would they take your kids? And when you say it like that, it's a no-brainer. And that's the way that we have to start having these conversations. We have to make them just common sense no-brainers and take the hot political divisive stuff out of it, and just make it that simple. So that's one of the reasons why this healthcare thing is so important to me, is because I know that they want to make a model out of it. I know that it is hurting people. I personally know of people who have died as a result of the changes that are happening in healthcare, and it becomes a very scary thing. So yeah, I'm excited to put the rest of the data together. It's just challenging because I have to look up all the hospitals and see what county they're in and then cross-reference the list. So, but it's going to be worth it. It's going to be so worth it to be able to talk to people about, keeping their hospitals and understanding that, nobody's going to take this, the governor, nobody's going to take the state away from the governor except the people. Nobody's going to take the state away from, its state representatives or its congressional representatives except the people. And so we have to start doing that and using their voting record against them. So
Yeah, that makes sense. I'll say one more thing and then that'll sort of be it for me. But I think something you said reminded me, if you talk to a lot of rural voters or the messaging that they're hearing, a lot of it is kind of like, well, what's the government ever done for you anyway, right? Like what's the Democrat ever done for you in the first place? And leading with the fact that they kind of want to shut down hospitals, like you're leading with what we've done for you. Like we're sort of like you're sort of leading with here's this benefit that's in place that Republicans want to take away. Here's this good thing that's in place that Republicans want to take away. So you're moving away from the premise of, well, prove to me that anyone's ever helped me before in the first place. And you're starting with, here's this thing that helps you. And these bad guys kind of want to get rid of it. And so I think that sort of rings true from what you were saying about the messaging you're trying.
yeah, 100%. So like I can tell you in this region, our about 70% of our payer mix is Medicare, Medicaid. So imagine what happens to the people in this community if they do get their way and we see Medicare go away. If we don't see them be able to negotiate prices for their, for their medications. So like one of the things that people don't realize is a lot of times the healthcare system also owns pharmacies. Ours does. They own several of them here. In addition to that, they own the infusion centers. And so one of the things that they did here is so let's just say that, you have somebody in your family that has lupus or that has cancer, and they require these infusions. So one of the things, the first thing they did is they moved our infusion center. It was a few miles down the road. So it was not on hospital grounds. Well, when it's not on hospital grounds, then they don't get to charge a facility fee. Okay. So by moving it to within 200 yards of a hospital, then all of a sudden they could charge a facility fee, which was $241. Now imagine if you have to get multiple infusions, one a week or bi-weekly or even monthly. How many people in rural America do you know that just have $241 or, $281 to just throw out for a facility fee? They don't. And then the other change that they made is, when you're in the hospital, they have, those group billing codes. Well, that means, there's a standard dollar amount that most, heart attack patients or most stroke patients get billed for. Back in the day, you used to get charged for every Tylenol and every whatever. Not anymore. You have a group billing code. Well, what they did was they changed which medications could be used for inpatient and outpatient. So the cheap medications were now for inpatient because that gives them the greatest profit margin. And then the most expensive medication was used for the infusion. That way, they got to bill more for the actual medication, and you may have a greater copay or an amount that was left over. So, it is important that rural America pays attention to its healthcare for so many reasons. First of all, because the majority of the people are going to be covered under Medicare and Medicaid. Those changes are going to be important. The closure of rural hospitals is there, and the likelihood of them creating medical monopolies is significantly high. So yeah, all of those things are, and believe it or not, this is one of the things. So I wear a t-shirt that I made during the protest that says country, not stupid. Country people, rural people are not stupid. We are simple, right? And when you simply tell people the truth and you break it down in common sense terms, that they accused me of being the pot stirrer when I explained to people what a COPA was. And I said, I'm not making people angry. I'm simply telling them in plain language what you all did. And yes, they're angry. And yes, they should be. And so getting people to understand, country people are not stupid. We just are simple. And, And God love us, we trust the people that tell us things, you know? And a lot of times that's how people get elected in rural communities, right? Is we used to, you know, we grew up with old boy in the holler and we went cow tipping together, and all of a sudden he goes to the same Baptist church or whatever that, you know, and next thing you know, they're in office, lining their own pockets and not working for other people. So hopefully what we're going to be doing in these networking calls every month and with deep dives like this is getting data together that gives funders reasons to give you money, gives philanthropic organizations issue campaigns where they can be the bridge between the organizers and your elected officials and the parties, right? And then it also gives you talking points and issue campaigns that will make the messaging relevant to the people who need to hear it. And so that's the goal. Is to be able to have the data that brings in the funds, that tells us where to put those resources when we get them, and then connects everyone together with the right value messaging for the people that need to hear what we're saying. So if anybody has anything else, let me know. If not, I will not hold you. I appreciate the comments and feedback, though. That's 100% on spot on what we want to do. So
I just want to reiterate what John said. Is I'm looking forward to getting the data and reviewing that. You know, here in White Pine, we're one of the smallest counties numerically in the state of Nevada, but we're a large county, so there's a lot of square mileage.
yeah.
And as such, you know, there's 5,000 and some voters according to the county clerk who I went to yesterday, and there's 823 Democrats. The rest are nonpartisan, independents, and of course Republican. So I need to get that built up because there are far more Democrats in this town than 823.
Yeah, we have the same thing in some of our areas here. So not Sullivan County, but some of our surrounding counties are the same, you know. And so that is one of the challenges is how do you, and Andrea has put it in this chat, is how do we maximize organizing in sparsely populated areas, which is exactly what Elwood is talking about, because door to door is time consuming and it's not always effective. And so one of the things that I've talked about is, so like, for example, we've been talking about getting out the vote and not waiting until, you know, 3 months before election day. During the summer, I don't know about where you all are, but like here, one of the things I think about is we have, they have a name for it, but basically what it is every Friday night, there's like a little local concert downtown and everybody's out there for vendors and everybody has like, you know, a little booth set up and there's a, you know, a band playing and whatever. Going where people already are, right? Because getting them to come out for something is difficult. And it's not because, you know, sometimes people assume it's because we're not interested. Well, I keep saying this, if you can keep people living paycheck to paycheck, right? If you can keep people broke, if you can keep them either underinformed or misinformed or disinformed, right? Then you win. Because how does a mom of 3 who works 2 jobs and can't afford extra daycare, how does she come to a town hall? So the key is to go where those people already are. Do you have a county fair that's going on? Can you get a float in the Thanksgiving Day parade? What are some of the other ways to get into the community and not necessarily do it from a political standpoint, but based on those 4 pillars that I keep talking about? So healthcare, education, housing, and economic stability. What are the issues where you are that bring people out or that make them the most emotional? Because that's how you have to tap into them. And if anybody else has any like suggestions or ideas about that, chime in. But that's what I have found to be the most effective, is going where they are.
I know this is going to be the boring answer, but I think there is also a lot more room for innovation in digital organizing in rural America. I think people people hear rural and they think, oh, there's no technology out there, and sure, the Wi-Fi is bad out here, but when your neighbors are farther away, your neighbors on your phone are the people you spend more time with, and I think getting sort of wrapping our heads around that is something I'm really interested in and thinking about more this cycle. And I think that, I think rural people, frankly, we're spending more time on our phones than we get credit for.
Yeah. Yeah, I agree. I think telephones is definitely, and then I also think little radio spots. One of the things that I know in Georgia is I couldn't go into a TJ Maxx without hearing a flippin' camp ad on the radio. And so I think we discount some of those small things. I will say this though, I would love to see a more coordinated, and I hate using that word because of the coordinated campaign, but I feel like if we're going to do phone in rural areas, it's gotta be with local people, with local numbers, and
For sure.
so that they're not getting 5 calls a day from, like, literally the Democratic Party, the coordinated campaign, the so-and-so's campaign, this organization. Like, people just get worn out by it. And so, yeah, it has to become personable. But yeah, I agree with you. I think that phones are an important piece as well.
But one part of that is there are so many campaigns that are nationwide. It might be someone running for a state assembly or trying to push somebody out of a Senate seat. What they'll do is that they find all of the Democrats throughout the country, and then they just push their ads out to all of them because they know some of them are going to donate. So they're not just getting it from the Nevada Dems and from White Pine County Dems and from the coordinated campaign and so forth. They're getting it from somebody in Ohio, somebody in DC, somebody in Florida, somebody, they're getting it from all over the place, and it's just too massive, I think, to coordinate. When you look at the total number of counties that's out there and the total number of people in the country that are running for something. So it definitely has gotten out of hand.
Yeah, well, that every time I start to think about things like that, my brain automatically goes, get rid of Citizens United. like that's where my brain first goes, get rid of Citizens United, right? But the reality is we do have to have message specific, community specific, verbiage and messaging that goes through. And yes, we're going to have some of that national stuff, and yes, we're going to get donors across the country, and we're going to have to not be lazy and earn the vote, right? And that means going everywhere, and that means talking to the people in the smallest of towns and having real conversations. And unfortunately, people look where they can get the biggest bang for their buck, and I get that, and I still don't know that that is going to work in and of itself anymore, especially not with the rhetoric that we have. And it's only going to get worse over the next year. We all know that. So the question becomes, how do we keep everybody from getting politic fatigue? How do we keep everybody from not becoming cynical? And, one of the things that came up in the exit interview campaign a lot, that project, was in 2016 and 2020, we had an external motivator, right? Which was Trump. A lot of people came out and voted because of Trump. We have to find a way to inspire people. And there's a difference between motivation and inspiration. Motivation is something that comes from, it's external. When you are inspired, nobody has to make you do anything. When you are inspired, it doesn't matter who's running and who's not. You are doing it because it's something from within you that drives you to do it. And that's the thing that we have to tap into again. Andrea heard me say it at the last session, hope gets people out of their house. And I think it's been a long time since people have felt real hope when it comes to politics and our candidates. Especially on a national level. So,
well, that's there's an easy way to do that. We just need to have an Obama in every county.
Yeah, you know, when I facilitated in Montana, I said to the entire room, when is the last time a candidate made you feel hopeful? And almost the entire room said Obama. And this is the thing. Hope connected us to our emotion. And the Republican Party has done that way better than we have. They have tapped to an emotion. Their emotion is anger and fear. We have not tapped into hope, and hope will beat anger and fear every damn time. We're just not tapped into it. We're too busy talking about their anger and fear to give people hope. And that's why we keep losing in places where it should be easy to win. Listen, if it was just policy, we'd win every time, but it's not. This is an emotional thing, and we have to start tapping into that emotion in people and giving them hope. So I just, you know.
I think that's a big hit right there.
Yeah, we have to do that. And so, you know, I've said people, especially like, because, okay, so healthcare and social justice issues are kind of my jam. And awesome, John. And, you know, I've had some Black people say to me, you know, it's no hope. It's always going to be racist. Or why do you always, you know, how are you so patient to explain things to people over and over again? And what I keep saying to people is, if I don't have hope, we might as well just all die, right? We might as well just hang it up and be like, forget it, we're done. We have to hold on to that. And then we have to create it and generate it. And I think the way we do that is to stop talking about, we have to acknowledge, but there's a difference between acknowledging that something is there and that it's a problem, and then just hammering on it all day, every day, in every ad and every campaign. That's stupid. We have to be talking about what we want to do and what we want for ourselves and our kids and our grandkids. And we're not doing that. So,
Yeah.
Go ahead, Elwood.
No, I was just agreeing with all that.
Yeah. So I would love to see you guys on the Thursday call. It's the last Thursday of every month at 2:00, where we do talk about more of this messaging, values, organizing, how to say things. You know, I love to talk about the controversial issues because I love saying them in a way that just makes sense to people. And then it's not Democrat versus Republican. It's just common sense versus stupidity or ignorance even. So hopefully you guys will be there. You will get an email from me soon. And then you'll also get a survey just about the data, the presentation, and all of that. How do you sign up for the last Thursday call? There in the email that I sent you for this, there is a link to that. Let me see. And you'll get it. It'll be in the other email that I'm sending to you in a few days, Andre. And it's the same link every month. So if you got that, it's in there. But it's at 2:00 on Thursdays. So I appreciate you all very much. I know we were a small group, but that's okay. Good things come in small packages.
How many people registered?
There's just the four of us on this call. I will tell you, like, some of them have been greatly attended, you know, with 25 and 30 people on the call. I want to see those numbers grow. I don't know how to explain it. Like, I think so many people are just tired, and it's a lot because there's so much going on all the time. But I would love to see us just get unified and to get excited about what we can do, because I will tell you, that's what happened to me when I was doing all the research for this and I was going through like all the data. I was like, because I moved back home in February to take care of my mom because of health issues. And I was like, oh my gosh, Mom, there are 6 counties in South Carolina, in rural South Carolina, close to flipping. And she was like, what? I was like, yeah. So it was crazy because I was getting excited and seeing things that we just don't think are there, you know? So the next time somebody tells you that your county is 60-40, say, you know what that means? That means 4 out of every 10 people that vote is a Democrat. That's close to 50-50. Good gosh, we're about there. and it just puts a different spin on it, you know?
Yeah, I'm wondering, because we've got 15 rural counties. And it surprises me that, I'm not seeing more people from Nevada here.
Yeah, I was surprised that more Nevada people didn't register too. So Andrea, I will 100% ask Matt and Afton if they're good with me doing that. And if they are, I'm happy to do it again. Yeah, so same thing with Nevada. And feel free to share the link for the last Thursday call, right? We can do some of the data on some of those calls and, give illustrations on how to use it. So yeah.
I think in part because it is so, well, people will say it's so early. I don't feel that way. I know that you don't feel that way. Elwood, I know that you don't feel that way, but I do think that that is part of it. And so and also I didn't know how good these calls were. So now that I know, put simply, now that I know, I've already shared it out and I've already gotten great feedback, but just the chance to be able to have a conversation with you as well. I think that a lot of people would get a lot out of it. And so that's why I was hoping you would do another Georgia call. I'll get some Muskogee County people on here, I swear.
Yeah, 100%. 100%. I will tell you this, Andrea, I cried for 3 days after the gubernatorial election. And I wasn't crying because quote unquote Stacey lost. I was crying because 500,000 people lost access to healthcare.
Oh yeah. Well, that and the possibility of, yes, definitely.
Yeah.
And the possibility of having Stacey Abrams as our chief spokesperson would have been phenomenal. The way that her policies feather. I hear what you're saying about the vulnerability, but I just, I've been in love with her since I first saw her, interviews.
I was too. Like, that's the only campaign, that's the only political campaign I've ever worked. I've had people ask me, would I work the Biden-Harris campaign and whatever. And I said, it would depend, on who asked me. Am I just going to run and go apply? No, because that's not what drives me. Right. What I love the conversations and the messaging and the training and the aha moments. And so I was talking.
And when you have a great candidate, it just does it for itself.
Yes, it does. Oh my gosh, it so does. I'm talking to people about, so I was at this thing and there was corporate folks there. So there's a white guy there, and I said, well, let me ask you this. I said, so listen, if you had to pay me $1 every single month just to live here, right? And I had a club that you could join. And if you join my club, you don't have to do anything different, nothing. It requires nothing extra from you. But I'll give you 90 cents of your $1 back every month. Would you join my club? And he said, well, duh. And I said, well, that's Medicare for all.
Right.
Right. You're paying into it anyway. That's expanding Medicaid is what I said. That's Medicaid expansion.
Right.
That's what that is. That's Medicaid expansion. You want 90% of your money back? Join the club. Because you're paying the money regardless. Do you want 90% of it back?
Yeah.
And
great messaging.
What can you say to that? No, I'm an idiot. I want to keep giving you $1. No. So yeah, that is the thing that I love to do, is just to make it I escort women here to our women's clinic. So I'm Bristol, but we have a Tennessee and a Virginia side, right? And let me stop recording. But